On the 11th day of it just ended. I mean, we're about to start in the 12th one. I hope that we're just as high and as energetic as we've been since day one of the holy month of Ramadan, being very strong in reading the Holy Quran and praying on time and praying Qiyam, doing all these things are so important, because I know a lot of people that would be a little bit tired by the 15th, the 16th, and then they would go energetic back in on the last 10 days, which is okay, but we'd like to be just energetic all over the month. This is the best way of it, and this is how we want Almighty Allah to look at us every day, every night, and see that we're there doing something to thank Him for all the blessings that we have. Today, God willing, we are going to talk about diabetics, diabetes, and the irritable bowel syndrome, something that is so special during the holy month of Ramadan, especially diabetes and diabetic people. How do they cope with the holy month of Ramadan? Are there any changes should be in their diet? Can they just fast like other people? So many questions about diabetes, and I know a lot of diabetic patients, they don't really take good care of themselves during the holy month of Ramadan. They think that this is something normal, just as the other days, or as they are on their medications, they are okay. We will know more about this from our guest for today, Dr.Mohammed AlSheef, the consultant internal medicine from Pulses and Vascular Medicine consultant. Welcome to Family Time, Dr. Mohammed. Long time no see.
Okay, thank you very much.
And happy Ramadan to you. First, I want to know from you the different types of diabetes. We know that there are two types of diabetes, and we don't know the difference between them in terms of the medications, in terms of the reasons, in terms of how these people are treated.
Thank you to bring up this topic. It is very important. It is very common. As you know, it is affecting around 25% of the Saudi population. Around like every 4 people, one will be affected.
One is diabetic, or one
yes,
is going to be?
No, one is diabetic among 4 people. So 25%.
Very high percent.
Very high, yes. It is one of the most common areas in the world.
Worldwide, the percentage is the same?
It is variable from one area to other, but Arab or Middle East world is one of the most common areas affected by diabetes, like Hispanic, in the States. So there are some risk groups, they have higher than others. So there are 2 types of diabetes mellitus, type 1 and type 2. And I would like to make it very simple, type 2 is the most common, which is affecting like, say, 90% of the total of diabetes, 10% is type 1, and 90% type 2. For type 1 diabetes mellitus, it is, as you know, I mean, just speak about simple physiology. So if you eat food, what will happen? The food will be digested into particles, particularly carbohydrates. So will be broken down to the glucose. So glucose will go to the blood stream. So what will happen?
To give us energy.
Yes, this is the energy product,
Yeah.
So what will happen? You need the pancreas to secrete insulin. So the pancreas, it's endocrine and exocrine gland. So the endocrine part, we call it Langerhans islet cells. So secrete insulin in response to the food. What will happen? It will stimulate the entry of glucose inside the cells. So what will happen? This is, if you have type 1 diabetes, there is deficiency or failure of pancreas to secrete insulin.
It doesn't secrete it.
Does not secrete it, and usually affect the children. We call it childhood onset diabetes.
But it remains with them.
Yes, it remains. It's a chronic, medical problem. It's not curable, unless you do some transplant.
Pancreas transplant, which is very rare, not
very rare. Regarding type 2, what happened? You have insulin, you have either adequate insulin or insufficient insulin, but the problem, you have the tissues, the cells, they have resistance. We call it insulin resistance, does not uptake the glucose. So you have the insulin, But the problem, you have resistance from the tissues. So we call
tissues
it
of the pancreas or of the stomach?
tissues, the tissues, the muscles, okay.
Your body?
Yes, body, okay, all cells, okay.
Does not absorb it?
Does not absorb it.
Why would it absorb it from outside when they take injections and medications?
Yes, that's why sometimes you need to, as I mentioned, it is either it is only resistance, sometimes combined. You have resistance and insufficient insulin. So sometimes we treat it by both, by drugs to stimulate the uptake or entry of glucose inside the cells, as well as we give them some medications to increase or stimulate the function of the pancreas to produce
insulin by the
insulin.
pancreas.
So just to make it simple, okay.
So one that is pancreas does not produce insulin at all.
Yes.
The other one, it produces it, but in a very small amount that is not sufficient enough for the body to
Yes.
work fine.
Yes.
And or the cells does not absorb it.
Does not absorb
if
it,
it's
yes.
this very small amount that is produced.
Yes.
Which is more dangerous?
Yes, and usually type 2 in obese people. So as you know, there is, correlation between the supply and demand. So the supply of insulin, okay, is not matching the demand of the body. If you have obese person, he need more insulin, okay, to stimulate the uptake or absorption of glucose inside the cells. And usually we call it maturity onset in older,
it's more common in older ages or people who are above their 40s.
Yes, middle age and elderly.
Above
okay.
that.
Yes.
Which of these two types is more dangerous?
Usually they are
as dangerous as
dangerous, yes. And the very important concept, okay, of management or treatment of diabetes to prevent complications.
Okay, we are going to stop at this. We are going to elaborate more in the treatment and how to treat diabetes.
And how to diagnose.
Why we're tackling this today, because diabetic people, sometimes they don't, or they are not aware that during the holy month of Ramadan they should be performing a bit differently rather than how they perform during their normal days or during their normal life. If it's not Ramadan, can they fast or not? The medications, the timings of it, the diet, how to eat. If, God forbid, if they went into coma, we are going to cover all of this, God willing, during our episode 4 today with Dr.Mohammed AlSheef. We are going to start with a report, and we'll be back. Please stay tuned.
الله أكبر سمع الله لمن حمده الله أكبر
Welcome back to types of diabetes. Type 1, that is, the pancreas does not produce enough insulin for the body, or doesn't produce it at all, and it affects children more, and it's the smaller percentage of that, like 10%, the 90% or the majority, overwhelming majority of people who are diabetic, they are of the other type that would affect obese people from their middle age and over, because it is a chronic disease. Dr. Mohammed, diabetes and the reasons behind that and the causes of it. Is there any clue? I know that it's unknown, but is there any new clue that now people would even expect if, God forbid, they might develop diabetes or they might become diabetic later on?
Yes, it's very important, to know the symptoms of diabetes, okay?
Symptoms?
Yes, to know the symptoms of diabetes. Would like to raise awareness about this, because symptoms of diabetes, if you have high blood sugar, we call it hyperglycemia symptoms. Usually they present with increase frequency of urination. So they are avoiding, okay, more frequent, particularly during the bedtime. So if you wake up during the night time, you're sleeping once or twice, okay, to avoid, this is an alarming, okay, this is, you might have, high blood sugar. The other thing, you have extreme thirst, okay, so what will happen, you will compensate by increase, drinking, okay, we call it polydipsia, okay, this is the medical term, as well as they will have sometimes blurred vision, and they might make accident, because if you have high blood sugar, you will not see clearly. The other thing that you might have hunger and eating a lot, okay.
They will be more hungry?
Yes, and eating a lot
than normal people.
Yes, because they are, because what happened, we call it the diabetes is starvation in the midst of plenty. So there is sugar, okay, molecules, but is not getting inside the cells, okay. So you have the fuel, but is not utilized inside the cells. That we call it starvation of the cells.
So you feel you need energy.
Yes.
That's why you will eat more.
So this is a term that I think it's best description. It's starvation in the midst
presence of plenty.
Okay.
Yeah.
And that's why they will have hunger, okay, so they will compensate by eating a lot, as well as they will lose weight. So these are the hallmark symptoms of diabetes. Many people, they are not aware about such symptoms are, okay, clue for to seek medical advice. So this is very important. So if you have such symptoms, don't hesitate to consult your physician. Okay?
Even if you don't have these symptoms, it's very important to know your number, your blood sugar rate, or this is so important to know it. I mean, blood pressure and the sugar rate in your blood. This is so important. At least once a year you should go, and you can have this in a pharmacy or the ER, in any hospital, something that is not going to cost you a lot, but it's very important at least that you would know your numbers. If someone asks you what's your blood pressure, you would be able to answer. If someone asks you the rate of your sugar in the blood, you would be able to answer. This is very important to know it just normally, away from the symptoms. It's
like this is in the West, okay, Western community, they have what we call health ID card, including your blood sugar, your total cholesterol, your triglyceride, your medical problems. So
in case of accidents or anything that, God forbid, they would know how to treat you.
Yes. So this is the symptoms of high blood sugar. Okay. If you have such symptoms, you should not hesitate. Sometimes you have what we call early stage of diabetes mellitus. We call it pre-diabetes. So this is a stage that is preceding the onset of diabetes. You don't have any symptoms. But this is very, very important stage. If you discover that you have, I will say, abnormal blood sugar, but without symptoms, okay?
Abnormal in terms of what? Like the normal should be like 4 or 5?
So we speak about the numbers, okay?
Yeah.
If you have fasting, okay, blood sugar,
yeah,
which is fasting, we say usually 10 to 12 hours, it should be less than 100.
Okay.
100 milligram per deciliter. So this is the conventional units, okay? And this is the most commonly used. Some they use millimole, okay? So less than 100 considered to be normal. More than 126, this is abnormal. So what will happen between this 100 and 126? We call it impaired fasting. It means this is, it's not diabetes, it's not normal. This is a stage which is preceding the onset of diabetes.
And does this stage mean that 100% this person is going to be diabetic?
Very important question. This is very important. That's why the concept of screening to check your blood sugar before, okay, development of diabetes symptoms. If you pick up, okay, or diagnose the pre-diabetes at this stage and you follow therapeutic lifestyle changes, okay, we'll discuss it later on, you will prevent the progression to diabetes mellitus, okay, and the studies ranging about like 50 to 100%. So you might continue your life in you only pre-diabetes, or it might convert to normal.
Normal?
Yes.
And the pre-diabetic, Are they on medications as diabetic?
Yeah, pre-diabetic usually for type 2, not for type 1, okay, as we said, okay, type 2 diabetes mellitus. And it's very important because if you don't do anything, they are studies 50 to 100% will proceed to
become diabetic.
That's important.
But there's a percent that you might be back again to normal, or you can continue your life being pre-diabetic, which is much better, of course.
Yes, much better. So I mean, this is very important point. If you are continue to follow therapeutic lifestyle changes, you will arrest the progression of pre-diabetes to diabetes. You stay even normal or in the pre-diabetes if you are following the healthy, you know, therapeutic lifestyle.
Are they going to be on insulin as well, the pre-diabetic patients?
So usually without medication, it's just therapeutic lifestyle changes. I mean, exercise, ideal body weight, okay, diet, okay, avoiding smoking and others. So this is just and avoiding alcohol. This is the therapeutic lifestyle changes, but not some people. There are some studies, I don't want to go deep, they add what we call the metformin, or this is the glucophage, very commonly used medication for diabetes to treat patients with pre-diabetes. Yes, it has some positive results from the clinical
Positive
trials.
In terms of what? These people would go normal, you mean?
They will stay as pre-diabetes or might stay or might be normal on medication. So it's a chronic medical problem. This is very important. There is no cure for pre-diabetes or diabetes, okay?
Now I want to know the people who are diabetic. Can they just fast type 1 or 2? Either we're talking about the two types now, and if there's difference, please, Dr. Mohammed, differentiate this for us. Can they just fast normally during the Ramadan, as especially this year the weather is soaring? It's very hot, like in here in Riyadh, sometimes it reaches 60 Celsius degrees. Yeah, we laugh at this. We pictured it, we put it on Facebook, and we laugh, and that's it. But only God knows how people, when they are outside in the streets, they continue like surviving, actually. Especially during this weather, can they fast? And as you mentioned that they become so thirsty later on, how they are going to perform?
Yeah, so this is okay, very general question. So let's classify patient on treatment. So patient on diet only, okay? So they are diabetic patient only on diet, okay?
You mean they don't take medications?
They don't take medication,
and
only
is this
on
okay?
diet. Yes, there is some. This is
depends on what, Dr. Mohammed?
Especially early stage level of blood sugar, okay? Early stage of diabetes or pre-diabetes, only on diet. So fine, they can fast. In fact, fasting is really the treatment.
Good for them.
Yes, good for them, because it will rest the pancreas to secrete in insulin, okay? And
but not drinking water would be okay for them?
During the, yes, it's okay. So they can fast as normal people, okay? So then...
But they shouldn't exert more effort or something like that, or...?
Because they are not taking any medications, only they are on diet. So fasting...
I mean their performance. We as normal people, we can perform normally. Some people go to work during Ramadan day, some people cook, some people just do whatever they have to do. I mean during the day, diabetic people can do the same?
For people on diet only, they can lead normal, life, and enjoy their meal. So this is one. For patient on medications, which we call it pills or oral hypoglycemic drugs. So there are like many over-the-counter, glucophage, Diatab, Dawanil. This is commonly and Dawanil. Commonly used medications, pills for diabetes.
Patients.
Yes, they can fast. What happened? For this patient, they have to, organize their meals. So you have to organize the breakfast and the sahur. So what happened? Usually, if they are taking let's say the most commonly Diatab or Dawanil. So they take it like 30 minutes before the breakfast, because it takes 30 minutes to onset of action. And if they are taking glucophage, they can take it with the meal or immediately after the meal. And before sahur, you can take it the same. So
who are the people of the category of the diabetic patients who can be only on tablets?
Again,
type 1 or 2?
Usually type 1 or insulin, Type 1 is the only treatment is insulin. But type 2, they can be on diet, they can be on pills, they can be on insulin.
But type 1, they cannot be on
Yes,
anything
only
except insulin,
insulin.
which is injections.
Yes, injections. And we'll leave it to the end. Okay, I'm just like
Yes.
stepwise